up, and they don't actually work as well as they should do. And this is a big problem. So effectively, if you think of any technologies, they often follow a trend. People get excited, they get really, really excited, and they realize, oh, it doesn't work. And then they gradually sort of learn, okay, well, maybe it works for this, and you get some sort of realistic assessment of how good it is. Well, we keep getting these peaks in non-invasive testing for diagnosis, for diabetes, but unfortunately, most of them tend to end up going down the hole again. So non-invasive testing is an interesting area, it's an important area, and in fact, just as an aside, it was first of all thought of by the Chinese when they thought of the technique of surface plasmon resonance, which is my research area and my colleagues. And effectively, what you do is you just have a thin layer of gold, and when some molecules stick to it, the actual angle where this effect occurs just changes, and you just measure that angle, and you've got a basis for making a sensor. And this idea was developed around about the 80s, originally in Sweden, and it's now the biggest company has now been taken over by GE Healthcare, and it's a relatively big market, and it's very successful. It's very successful what it does. It's used a lot in the pharmaceutical industry for looking at potential drug compounds, but it still hasn't made it yet into the outside world. So the basic system is actually quite a simple idea. You've basically got a light source, you've got a light detector, you've got a bit of optics, and you've got some biology, some fluids flowing. That's all you've got. Now, actually, if you look at that, if you look at what's in there, a lot of that what's in there is actually in the mobile phone. You've got a light source, you've got your camera, you've got a detector, you've actually even got a little computer there for processing, so you've got a lot of stuff, and also you've got the ability to communicate results. So actually the idea of making a surface plasmon sensor which allows you to do disease diagnostics real time based on your mobile phone is certainly a possibility. It wasn't a possibility in the old days because a phone here's a mobile phone. It was advertised at a mere $4,000 US, which is about 10,000 in modern money, which I don't know, is about 300,000 baht or something. But now, of course, it's much more affordable. So there have been ideas to use the light source of the phone, use the camera of the phone, and do a few add-ons. And in fact, one of the papers was published by a group in Thailand. I've forgotten the actual reference. I've got the reference on and that will allow us to look at much smaller numbers of molecules, which ultimately will give you more sensitivity and actually is very important in some disease diagnosis, such as cancer, also infectious diseases, where very small quantities of certain chemicals change by a large fraction. So although there's not many of them, they change by a large amount. And so we're looking at seeing if we can look at very localized regions to make these measurements. And because these are very, very strong indicators of disease, so-called cytokines are the indicators, are a messenger sort of proteins which basically will tell you what's going on in the body. So, summarizing surface plasmon, it's been very successful in the pharma industry, but we need to enhance its capabilities to be either more specific or more precise detection, and also the recurring theme of this talk, integrating it much better with consumer electronics. So, told you a little bit about where we are now. I'll just tell you another thing as a success story, and it's a success story which is because actually, for once, the human body is being very obliging. And it's a pulse oximeter, and it's a really simple device, and actually I've got one upstairs, tiny little thing, and I just forgot to bring it down. But you can just click it on your finger and it works. And there's a nice history, really, and it serves an unmet clinical need, and it's moved from a very exotic tool in the operating theatre to something, a cheap and universal point-of-care thing, maybe costing, I don't know, 100 baht maybe, no, a bit more maybe, but not much, to a consumer toy, and actually as a consumer toy it probably was a step too far. And the point about the pulse oximeter is it's very simple instrumentation built around very simple optics, and it can measure your oxygenation in your tissue, so hypoxia. So in other words, when your organs are short of oxygen. And it offers real-time monitoring, which is very important. And initially, the method was used in operating theatre, but now it's widespread. In fact, my mother-in-law, who's nearly 91, has got basically quite healthy, apart from her breathing difficulties, and has one of these sort of more or less all the time, and she's very happy to use it, and it's very simple. So chronic respiratory problems, very good. So basically, you've got the circulatory system, and this is how an engineer thinks of the circulatory system in a nice, simple, clean way, rather than lots of nasty, real things. But you can see that basically the blood goes through the body, loses oxygen, but in the tissue, it should be pretty rich in oxygen. And so basically the idea is, and this is where physiology is helping you, is oxygenated hemoglobin has a very, very different optical signature, looks very different from deoxygenated hemoglobin. And that is why this one is successful and the glucose one is unsuccessful. Glucose has hardly any signature at all. It's very, very hard to measure. You've got to use quite subtle techniques to try and get at it. This doesn't. So Stokes, who's a very famous guy in physics, who's working in sort of 150 years ago or so, was the first to observe that the colour was related to oxygen in the blood. And but then people started using simple transient illumination devices around that just before the Second World War, and then it was improved, and then it started getting used for anaesthesia. And then the oximeters were developed by Hewlett-Packard, and they were bulky and expensive, costing about 10,000 US, but they were valuable. And and then what happened is this Japanese guy had the realization that you could make the measurement by synchronizing it to the heartbeat. And this made the whole instrumentation enormously more simple and more reliable. And by synchronizing it to the heartbeat, I think it's interesting that from 1974 was the first announcement. It was on the market in 75. And this shows two things. It shows the technology is actually basically quite simple. It also shows that there was a real need to do this. Why was there a need? Well, before the advent of using oximetry in the operating theatre, maybe one in 2,000, one in 7,000, deaths due to, asphyxiation occurred. Now, that doesn't occur a lot, sound like a lot, but it's quite a lot. If you're involved in 10 operations, your chances are going up pretty high. So it's quite very different at different ways, one and the infrared one, and you basically can make your measurements in a very simple way. And there's just pictures of the electronics, which are boring. But, again, the trick goes on. The trick goes on that you basically try and use this in terms of using your mobile phone, using the light-emitting diodes in the mobile phone, some of the photo detection in the mobile phone. So it's a route. And if you want to pay 38 Hong Kong dollars, so that's about 150 baht, you can get an app for your iPhone, which probably doesn't work. But it gives you some numbers which look convincing. It probably doesn't work because I don't think it's using two wavelengths, and I think it's quite important to use two wavelengths. And they're very, very conscious of saying not for clinical use. So it becomes a toy, but actually you're not far away from being able to make the real thing around a mobile phone, but I don't think this has quite done it. So that's where we are there. Now, where can we move on from there? Well, that's interesting, because there's a lot of other wavelengths of light that you can use. And a lot of these wavelengths have been put down as promising areas where you can actually maybe combine oximetry with measuring glucose. Well, maybe you can. I think it's probably worth investigating, but don't raise your hopes. But again, it's one of these things which has a small chance of success, but a huge prize. There are other things like using techniques called Raman, where you can actually identify the molecules. So these are all developments of techniques for oximetry, very successful, and people are trying to squeeze a bit more out of it. The last few minutes, I'm going to talk the other disease that people is going to grow dramatically in the world, of course, is Alzheimer's disease. And again, there are sensors can look at this, and this is an important area. The figures, of course, are frightening. I think you can focus on any of these, but I think the one is that the cost of Alzheimer's disease in the world would be expected to make it something like the 18th largest economy in the world. So it's going to cost the world a lot. And of course, as we improve our healthcare in other respects, we're going to have bigger problems of people getting old. So, okay, so Alzheimer's disease is associated with so-called plaques being formed in the brain and associated cell death, and certain to want to make the diagnosis. And also, more generally, you know, just for the medical community rather than the individual patient, if you want to develop effective treatments, you need to be able to monitor people, and therefore you need to be able to categorize them correctly, and therefore there's another reason to make a good diagnosis. So, diagnostics is either by behavioral cloning, PET scanning, which is expensive technology using radioactive chemicals, and it's got fairly poor resolution, and basically it's just imaging the brain. And actually, speaking to clinicians, they've said you look at some brains and they look absolutely terrible and the person's functioning perfectly normally, and others actually. So it's not actually guaranteed. You can look at the cerebral. It's actually quite a lot of things. The other thing you can do is look again at the retina and look at the sort of basic patterns, and looking at lots of the signal processing things like how tortuous, how bendy it is, how fractal, how much branching is going on, and basically finding metrics for the basic shapes of the patterns is another strong indication. I think combining these multiple techniques is a promising route forward. And I think, again, this will, combined with big data, where you can look at large databases, could be a very promising route for the future. And I'm just going to finish off by talking about some other things that I think are developments, not specific diseases, but perhaps new paradigms for electronics, which I think will be interesting to look at. People have been, what you want in biosensing is things that are in relatively lots of holes in them, so they're not going to interflow with the flow too badly, so they're pretty non-invasive as well, as non-invasive as you ever can be when you're sticking something into your vital arteries. I think another area is so-called transient electronics. Now, if you're an engineer, transient electronics means a spike, but actually transient electronics means something else there. It means electronics that doesn't last very well. That doesn't mean just badly made. It means that it's actually got controlled disposability, controlled lifetime. So that's electronics that can partly or fully dissolve or reabsorb and actually physically disappear. So you can imagine this sort of technology being used for implantable therapeutics, diagnostics, environmental monitors, and also, hopefully, zero waste. Because, of course, we all know that the waste from electronic components is a major environmental problem. So, two examples here. One is the soluble electronics. It's built around basically magnesium oxide, making some of the gates. And it's built on a silk screen, and it was published about 4 years ago. And this is a beautiful picture, I think, of just basically sticking it in water, and the circuit just disappears. It just dissolves away. So you've basically got something you could put in the body, and hopefully it's not going to do too much harm. And I just thought, as a complement to that, I mentioned the pulse oximeter as one of the great successes in simple optical monitoring. People recently, I think this was about 2011, published in Nature Communications, some work where they used a completely organic pulse oximeter. So they use organic light-emitting diodes and organic photodetectors, and actually that seemed to work quite well. It's not, obviously, it used slightly different wavelengths from the other things, but it worked pretty well. So you could imagine combining optoelectronics together, so we could actually start building what happen. And that will be very important. So actually, it just brings me to my summary, really. One thing I've barely discussed, but which is actually incredibly important, is nanotechnology. Nanotechnology is going to deliver a lot of capabilities, and it will integrate with a lot of the technologies that I've talked about today. But it was just too broad a subject to deliver here. So what are the challenges? Well, a major challenge is to make sensors ubiquitous and integrate them with consumer electronics. It's a point I've made repeatedly, but it's very important. In a way, that point goes somewhat against the point I made right at the beginning, where I said the healthcare market is sufficient to develop its own research and development environment. Yes, I think it is, but actually, nevertheless, if we can, by hooking on to consumer electronics, there'll be a lot of progress. And there's always a lot of interest in papers that use that. I think it just needs some more real demonstrations. But I think there'll be I think this is related to the increase in Internet of Things, big data. Once we get to the next generation of interconnectedness, there'll be a far stronger drive to use technologies which are based on, basically on your mobile phone or on devices that you have in the home. The challenge is how different materials base from what is pre-existing. I think one thing that is important is the market for sensors will soar, both from the consumer. The consumer is ever voracious. If it's at the right price, they'll buy it. But the governments will want it as well, because it's actually going to be a way of controlling costs. Central laboratories are very expensive. And actually, cost control certainly in the West for healthcare has become really almost the #1 political issue. It's a major, major problem. And I think optical technology, which is where I come from, where I started from, will play a major part. It won't solve all the problems, but it will be integral to all these technologies. Thank you very much.
Okay, so that was our talk on optics in healthcare. So may I ask everyone if you have any questions to ask from Professor Somek? Any questions? Okay, please proceed to the microphone, please.
Well, I have dual hats. I'm an economist, I'm a professor of economics at Western University, and also an applied scientist, mainly working in physics. I'm the chief editor of American Journal of Applied Science, which is in the same tier as Nature. And my major focus as the chief editor is to see how we can bring all theoretical developments to the practical use, especially in healthcare. So I really enjoyed your talk. I have two questions. One is nanopollution is a very major threat. Nanopollution, yeah. And you didn't touch too much on this. And I think we have to go beyond the optical technology. The optical technology is outdated. We have to create something new. The question is, who is going to create? If you look at the reinsurance industry, this is where my economics, training economics is important. You know, the top three reinsurance firms, Munich Re, Swiss Re, they actually have $50 billion worth of assets, and we have to get them to sponsor some of the research so that we can cross the barriers. And how do you do that? How do you convince them? You raise a very important issue that there is some kind...
Be much, and I don't think you're going to convince governments any other way than actually by hard economic facts, if such a things can exist. And I think it's really just got to be just hard-based cost-benefit analysis. And this is why I was arguing a lot of, in a way, for things like consumer electronics, because actually that is things that the people will fund themselves. Individuals will fund it. So actually, individuals won't even be aware they're contributing their tax dollar, because actually they'll be paying out of their own pocket and they'll think, oh, this is a nice toy. And so, you know, I haven't any really profound insights there, but I think actually democratizing it, sending things out into the population as a whole, for them to make their own choices, something governments are always frightened of doing, of course, is actually probably the way to do it. But, yeah, not a definitive answer, but it's a very good question, and it's the question, really. Yeah.
Okay, some other questions? So no more questions. Okay, so thank you so much, Professor Somek.
Thank you.
ค่ะในโอกาสนี้นะคะขอเรียนเชิญท่านอธิการบดีนะคะท่านรองศาสตราจารย์สุภัทราโกษยการนนท์ค่ะมอบของที่ระลึกให้แก่
ได้ครั้งเดียวแบบว่าคือตาได้อยู่ครั้งเดียวกับทาเนี่ยถ้าเราคือที่หัวเราะอย่างนี้ที่เสร็จหัวเราะด้วยเขาว่าไงเราเลยบอกดูสิหัวเราะเลย
Because they already closed it. I can see that it's not safe. We can take the progress. We can test.
Some of the reimbursement totally together or separated?
Together.
Okay, so 6,000 something Australian dollars.
Yeah, I wrote it. Yeah.
Okay, so and you're gonna be here in the afternoon for sure,
Yeah.
for the oral presentation.
Yes, because my session is after lunch.
Okay.
Yeah, and then we will be here. And then
Okay. So I will share that in the whole amount
Yeah. Yes. Yeah, because I paid for the fare, so I paid for it. That's
Yeah, I had my coffee break a while ago. Request everybody to please come back to the conference room now so that we can have our second talk. Technological innovations.
Professor Parrish ค่ะอีกสักครู่นึงนะคะเดี๋ยวเราจะเริ่มด้วยจะต่อด้วยการบรรยายพิเศษโดยท่าน Keynote Speaker ท่านที่2นะคะ Professor Parash Narayan นะคะซึ่งวันนี้ค่ะท่านก็จะมาพูดใน
No, there's nothing wrong. But I'm just beginning to have my headache, that's why.
Thank you. I want to begin by thanking the Rajamangala University, in particular the president, the deputy president, for inviting me to talk to you about something I'm doing currently, which relates to the theme of this conference. And what I'm going to talk to you today is on the extreme end of what you heard this morning from Professor Michael. So Michael talked about medical science and technology. I will talk about social science and technology. In my paper today, focus is more business aspect of how technological innovations influence the stock markets. And therefore, in this paper, it is a entrepreneurial approach, if you like, to understanding how technological innovations influence the financial markets. So really the key question is what is the motivation, and why should we study technological innovations or technology and its effects on the financial system? There are very good reasons why we need to understand how technology impacts financial system, financial markets. And a lot of the inspiration for understanding this relationship goes back to many decades when people started looking at technology and economic growth.
Trying to establish a theoretical connection between technology and financial market performance.